But disease eradication is the holy grail, or it's the epitome or the final frontier in public health.
The core value of public health is social justice. If we are not advancing social justice, if we are not attending to equity, then we cannot build the coalitions we need in order to take on the great problems of our time.
When I talk about equality, it's ensuring that I treat every patient equally with the same respect. With equity, I look at it from the prevention side, that we are preventing all of the diseases, all of the illnesses equally amongst all people. So you really give everybody the same opportunity to succeed.
Everybody should be treated fairly and equitably. We know that there are some countries that are very poor and some countries that are very rich. COVID, for example, is a threat to citizens in all of those countries. And a vaccine can be equitably made available to all people in both of those countries.
We can't continue to hold parts of our society back and expect that the whole society is going to move forward. It takes all of us, and being able to give everyone the opportunity to realize their full potential makes all of us better. It makes us more healthy, it makes us more balanced, it makes us more economically viable.
Needs and priorities are different. So equity addresses those needs and priorities. So in terms of funding dollars, it might be because of backlogs and discrepancies in the past, historic inequities, you have to actually spend more on certain activities and functions than elsewhere.
We can't fight disease by simply caring about ourselves. We have to be more worried about each other, about our collective future, and about our children than worried only about ourselves and only about today.
Without health equity, there will always be barriers to all of our health. We all should be concerned about health equity because we live in an environment where each of us is impacted by the health of others. And so the lack of health equity is a major issue for us. It's a major challenge for the future.
Equity and equality. So how are these different again? Equality is really about equal distribution of resources, while equity is about intentional distribution of resources to close pre-existing gaps. Gaps created by nature, by politics, by racism, by tribalism, by systems.
In other words, equality is about making sure everyone has the same thing, while equity is making sure that we look at people as individuals or groups with commonalities to see where they are lacking and seek to make them as whole as the others around them. This takes into account the critical notion of what certain people may be missing that prevent them from experiencing the same quality of life as others.
Imagine how it doesn't really help someone who needs the use of a wheelchair for everyone on the planet to be provided with a wheelchair. Equality can be wasteful in this way, but it truly helps the person who needs a wheelchair for them to have one, and for all the elevator buttons to be placed where they, in their wheelchair, as well as others, can reach them. This is equity. If we are to become better ancestors, and we are to change our world for the better, we need to build equity into our world. Without equity, those lacking the most become humanity's weakest link, making all of us more vulnerable.
The U.S. Centers for Disease Control and Prevention, CDC, refers to health equity as when everyone has the opportunity to be as healthy as possible. In this Becoming Better Ancestors series, we are learning 9 key lessons from the experience of the public health leaders who helped to eradicate smallpox, the only human disease ever wiped off the face of our planet. These are 9 lessons for changing the world. And this is one of the most important. This is lesson 9. The best solutions move us closer to global health equity. Let's go to the classroom.
Dr. Bill Foege is a legend in public health.
He has spent his life finding and fighting diseases around the world. He served as director of the Center for Disease Control under President Carter and Reagan. In 2012, President Barack Obama awarded Dr. Fauci the Presidential Medal of Freedom, the nation's highest civilian honor for his work in global health, in particular for helping to eradicate smallpox. Dr. Susmita Parashar is a cardiologist at the Emory Heart and Vascular Center, an associate professor of medicine at Emory University School of Medicine. She is a passionate clinician researcher and educator and trains medical students, residents, and cardiology fellows. In addition to being an accomplished medical figure in her own right, Dr. Parashar's career was inspired by her father-in-law and mentor, Dr. Mahendra Datta, who was a field expert working for the Indian government during the height of the smallpox epidemic in India. He ultimately rose to become India's Deputy Director General of Public Health.
An effective vaccine for preventing smallpox had been discovered and utilized over 225 years ago, as early as 1796. And by the 1970s, thanks to the tireless work of Dr. Fauci and hundreds of thousands of public health workers and the commitment of many countries to the efforts, widespread vaccination in higher income countries resulted in most people in these countries being fully vaccinated. Rich countries were almost completely protected from the threat of smallpox. In fact, smallpox was completely eliminated from the high income nations by the early 1970s.
You would think there would be a more level playing field, that the benefits of medicine would go to everyone, but that's not the way it works. And so long after smallpox vaccination was available to rich countries, we found that poor people in poor countries were still getting smallpox. I once saw over 1,000 cases of smallpox in one area of Nigeria, and I thought to myself, this is a threat to the entire world. Global health equity should be the objective of everything we do.
Some of the most powerful nations acting through the World Health Organization came together to eradicate smallpox. Many nations recognized that this threat of smallpox needed their resources, not only to protect the poorest nations who were suffering, but in order to protect every person everywhere from this terrible, disfiguring, and life-threatening disease. In today's dollars, WHO nations spent over $1.8 billion from 1967 to 1977. Experts led one of the most significant global health initiatives ever taken, and it worked. The eradication of smallpox meant that even in the poorest places on earth, where smallpox had ravaged the population for centuries, every human would now be protected. The global smallpox eradication campaign completely leveled the playing field.
And when you have eradication, this is the ultimate in global health equity. No one has a different risk for smallpox, and no one that will ever be born has a different risk for smallpox. It's zero for everyone.